What are you looking for in radio? Illumination, inspiration, celebration, or revelation? How about fascinating guests, stimulating stories, and thought-provoking solutions? It's time for another look at life with Stephanie Phelps. Here's Stephanie.
Hi, everybody. It is time for another look at life. I'm Stephanie Phelps, and I am here today with Dr. James Brown, MD. Dr. Brown is a native of Cleveland, Ohio, a graduate of Howard University and the University of Toledo Medical School. He trained in gastroenterology at the Cleveland VA and University Hospitals of Cleveland and practiced for 30 years before retiring. Dr. Brown started a practice incorporating traditional Chinese medicine, Ayurvedic medicine, nutrition, yoga, and Qigong with allopathic medicine, and introduced these modalities to the Black community of Cleveland before retiring again. He now practices internal medicine on a part-time basis at a federally funded community clinic. So again, Dr. Brown, it is just such a pleasure to have you with us. I was joking with you before we started that you've become quite the sought-after expert to talk about various topics related to medicine here in Cleveland. And so how'd that happen?
I made the acquaintance quite some time ago with Lynn Hampton, who has a radio show. I was doing a medical seminar with my partners in Chinese medicine and Ayurvedic medicine at a apartment building. And for whatever reason, Lynn Hampton's came in and joined, and he enjoyed his experience, and he started to have me on his radio show. And people somehow think that I have something to say. I am certainly very blessed to be able to use these platforms to try to educate our community and any of those who have an interest in understanding the broader aspects of health and wellness than what we've just traditionally been taught.
Yes. So, we are going to talk about non-traditional medicine, or Western medicine, I think, as it is also termed. But before we do that, let's learn a little bit more about you. You are from here in Cleveland, and I believe you attended John Kennedy High School. So how did you, I would like to know, how'd you get, so interested in medicine? Was that the original plan?
Oh, absolutely. I have never wanted to be anything else other than a doctor. I decided probably before the age of 6 that is what I wanted to be. And I've never thought about becoming anything else. And I have retired twice, and it just didn't take. So I keep coming back to do what it is that I enjoy doing. And that's helping people understand and take care of themselves in a physical, mental, and spiritual fashion.
Okay, now you've been wanting to be a doctor since you were 6. So again, why? I mean, did your mom say, you should be a doctor? Doctors make a lot of money, whatever. I mean, why did you want to be a doctor?
As you may know, so much of what we do as adults has its roots in our experiences as children before the age of 8. Children before the age of 8 operate in a very low brainwave state called theta. It is almost like a hypnotic trance, and they just absorb whatever is going around their environment at the time. So I believe it was between the ages of 5 and 6 that I had an umbilical hernia. And My mother took me to see one of the preeminent surgeons in Cleveland. He was one of the best known Black surgeons. His name was Dr. Butler. And I had my hernia done at Mount Sinai Hospital. And in his office, he took the stitches out. And at that time, seeing him in his white coat and his stethoscope, and he's fixing me up, somehow that imprinted me to, that's what I want to do with my life.
Okay. Well, that explains it because, doctors do have a profound effect on us. And I would like to speak to your effect on me personally. So I have to tell this story. About 20 years ago, I had an ulcer and you fixed me up. And I never forgot your name because it's James Brown, Dr. Feelgood, right? And then all these years later, here I am again engaging with you. So, but how does it make you feel when someone tells you a story like that? And if you, had the impact on others that you had on me, I'm imagining that you have more than one story or two to tell.
Truly, for those of us who see what we do as a calling and not just a profession, but it is part and parcel of what we are in the world, that is the fuel that keeps us going. When so many of the mundane things about medical practice nowadays, there's so many things that cause physician burnout if you don't really understand and practice self-care, but it is the reward that we get from patients like you who come back and, well, number one, who follow the advice that we give, because all we can do is recommend. I think that you should do this. This is my experience on what will work. And for people who follow that, who trust us enough to follow that, and then get the benefit of getting healed, of reestablishing some wellness, and then coming back and telling us about that. That is the fuel that keeps us going. That is what we use to get up and do what we do on a daily basis. Mm-hmm. So thank you for that.
Thank you. You talk about burnout. And so what do you think are some of the major causes of burnout, and how have you avoided that? You did mention self-care.
Well, one of the things, when I first started medicine, I graduated from medical school in 1975. I finished my internship and residency in 78, finished my GI fellowship in 81. So I started my practice in 1982. And at that time, the medical profession was run by physicians. That means people had private practices, they had group practices, or they worked in PPOs, physician provider offices. So around the time in the late 80s, early 90s is when insurance companies started to purchase the practices of physicians. And when insurance companies started taking over the medical business, your time no longer became your own. So whereas if you were in private practice, you could set your schedule and set how many minutes that you would set to see this patient or that patient. When insurance companies started to own the practices, then you became an employee and they set your schedule. So then medicine became almost an assembly line. On top of that, there became the practice of so many insurance forms and prior authorizations. Before I can do this test, I have to get the insurance okay. Before I order this x-ray, I have to get the insurances okay. So the paperwork is what drives so many people out of the practice now, and also the fact that their time is not their own, that they're seeing patients on an assembly line basis rather than on an as-needed basis. Some people may only need a visit for 10 or 12 minutes. Some people may need a visit for 40 minutes, but your schedule is not set according to what you think a patient needs. It's set according to how much money can you generate in 15-minute, 30-minute, or 45-minute increments.
Wow. So how would you say that has impacted doctors or people who want to become doctors since then, since they know that, now their practices are bought by these insurance companies?
Well, here's the interesting thing. It's like if you've ever had the experience of having had some kind of computer issue or electronic device issue, and you may ask your children or your grandchildren for assistance. They were born into a world where this already existed. We were born into a world where we had to learn the skills and the techniques. That was already in the zeitgeist when our children and grandchildren were born. So if you don't know that another way of life existed, then you accept this as the norm. And that's what physicians coming out of medical school now, they accept this as the norm. For the older physicians who knew life at a different time, it becomes more of a, it can become a burden. But again, I retired twice, so I only work part-time. And because of some of the other practices that I do, I keep my energy up, I keep my enthusiasm up. And again, I have enough time to decompress in between my office days.
Okay. Yeah, that makes sense. It's like they know nothing else, so this is the normal for them. Well, thank you for that. You know what? I think this is a good time for us to go to break. So we are going to do that. I want everybody to stay with us. We'll be right back with more of Another Look at Life right after this.
We remember when we first heard you were on your way, having no idea of exactly what you'd be like or how we'd play a role in your growth and development. But look at you now, 5 years old, making an impact in the community, and still, this is only the beginning. The best is yet to come. On behalf of the team at Another Look at Life with Stephanie, happy birthday, WOVU, the best station in the land.
Welcome back to Another Look at Life. I'm Stephanie Phelps, and I am here with Dr. James Brown, MD. He is a semi-retired medical physician, and he started practicing or incorporating traditional Chinese medicine, Ayurvedic medicine, nutrition, yoga, qigong with allopathic medicine. So I want to pick up from there, Dr. Brown.
Yes.
Explain to us what allopathic medicine is.
So allopathic medicine is the Western medicine that comes to us from Europe. It is the concept of disease starts on a cellular level, and the treatment for diseases involves using usually patented medicines. In America, this really was fostered a lot by the Rockefeller Foundation, the Carnegies, and I'm trying to think of J.P. Morgan back in 1910, 1915 or so. They hired a scientist from Johns Hopkins to look at the practice of medicine, and they began to decertify what they considered were medical schools not up to standards. But what they had is they wanted a viewpoint of being able to use patented medicines as the major treatment for diseases. And so that's where business, i.e. the pharmaceutical industry, actually started to integrate with the medical community. And that's when people like osteopaths, chiropractors, other traditional practices were somehow marginalized. It also put up obstacles for people who used herbal medicines, and for as the 80s, as the 60s, the 70s, and the 80s roll about, also marginalizing things like acupuncture, massage therapy, chiropractic alignments, and anything considered alternative other than using the standard pharmaceutical treatments to treat disease. But basically looking at the body as a machine and separating mind and spirit from the body and just treating it with molecules based upon cellular abnormalities.
Okay. So with this patented medical approach, I guess I'll call it, what would you say made you, well, you were trained traditionally, so what made you decide that these other things were, a good way to go? Yeah.
I had been practicing medicine probably for 18 or 19 years when one morning I was getting ready to go to work, and I was just getting myself together, and it dawned on me, I only cured one thing. And the one thing that I could cure, which means that you heal somebody completely from this particular ailment. The only thing that I cured was infections. If you have a urinary tract infection, if you have pneumonia, I can give you an antibiotic and we can clear that completely so it never becomes a problem again. But I was treating arthritis, hypertension, diabetes. I was treating autoimmune diseases. I was treating ulcers. I was treating colitis. I was treating Crohn's disease. I was treating autoimmune hepatitis. And the best that I could do is to put people in remission. But I had to keep them on medicine to keep the illness at bay. If they stopped their medicine, the problems would come back. And then it occurred to me, there must be a better way of taking care of people rather than keep them on medicines in perpetuity.
Wow. Yeah. So when you fixed me up, I think that was permanent because I think that ulcer was related. Was that related to an infection with that?
H. pylori. Yes.
Yeah. Okay.
But see, now here's the thing, though. just in that simple factor. Mm-hmm. So when I first started medicine, it used to be considered that ulcers were because of people having too much hydrochloric acid. Mm-hmm. And so we used to, so that's when we would use medicines which would block the stomach from making acid. But later on, the research showed that it was actually an organism called H. pylori, which changed the acid-base balance in the stomach or in the small intestine that produced the ulcer. And so again, treating the infection is what actually cures the patient. But before then, we would use medicines to stop the stomach from making acid, and the ulcer would heal, but it frequently would come back because we had no knowledge of the underlying infection until sometime in the 90s.
Wow. Now, you trained in gastroenterology, and so you mentioned all of these other illnesses, ailments, diseases that you were treating. Did you ever work in exclusively, in gastro?
Yes, yeah. I started off doing a combined practice between 81 and maybe about 84. And then from about 85 until I retired in 2010, it was strictly gastroenterology. But of course, in order to keep your license, you have to have so much continuing medical education. And I never lost my thirst for understanding the totality of the human experience in health and wellness. So I would go to medical conferences 2-3 times a year, and I would still review cardiovascular disease, kidney disease, neurological problems. So I still kept up to date on all of the advances in treating those diseases too, even though my practice was strictly GI.
Okay. Now, I'm also curious. When I met you, you were at Kaiser Permanente. So when you retired the first time, is that where you retired from? And is that when you started really incorporating the traditional Chinese medicine?
I started my holistic health practice while I was still working at Kaiser. And so I retired from Kaiser at 2010, but I started the holistic health practice probably around 2007, 2008, somewhere around there. And I did that for about 6 or 7 years. But the problem with it was that at that time, insurance companies would not cover anything in the Ayurvedic sense, anything in the nutritional sense, and all that they covered in traditional Chinese medicine was acupuncture for the nausea caused by chemotherapy for cancer patients. So most people that came to the practice had to pay out of pocket, and many people found that difficult to bear because they were already paying for medical insurance in other ways. And so it just became non-sustainable because everything was out of pocket.
Wow. Well, when you started the holistic practice, can you give me a story maybe about like your first success in that area, and is that what kept you going?
What kept me going was the excitement of trying new things on people. So yes, I actually watched somebody come into our office and they had a severe case of bronchitis. So they had fever, chills, weakness, and coughing. And my colleague put acupuncture needles in the head, neck, and chest area, sat them in a chair. And after 40 minutes, all of their symptoms were absolutely gone. And I just thought it was some kind of a miracle.
Did you say 40 minutes though? Really?
40 minutes, yes.
Wow.
40 minutes, the coughing stopped, the fever dropped, the fatigue went away, their body aches all gone. And and he gave them a prescription for some Chinese herbs, and we knew a place down in the Chinese Chinatown, their marketplace, where the person could go and get the herbs that would seal the deal in terms of curing the infection. But all of their symptoms were gone in 40 minutes, just with about 10 needles at various spots in the head, neck, and chest area. And I just thought that was a remarkable thing, because people would come to my office and they would have a respiratory tract infection. And I would prescribe them some amoxicillin and give them some Tylenol. And it would take them probably maybe 48 hours before they felt significantly better. And here in 40 minutes, this person is walking out smiling, breathing normally. And I just, that was like, oh yeah, this is how medicine should be.
Yeah. Wow. That is like really a wow. You know, I say wow all the time, but so this is it worked. And you said the person is walking out feeling fantastic. But I got to ask you a question about acupuncture.
Yes.
Does it hurt?
No.
Okay.
So we think of needles as like when we're going to the phlebotomist and having our blood drawn.
Mm-hmm.
The needles that acupuncturists use, the biggest one is the size of a strand of your hair. And there are some so much smaller than that.
Oh.
So most of the times when they go in, you don't even feel it.
Really? Okay.
Yes.
Well, see. Okay. Well, see,
Yes.
I hope somebody else learned something because I was thought, that probably hurts when you see all of these needles and people and stuff. So, yeah.
That's because the needles that we use in Western medicine to give shots, to draw blood, are 4 to 5 times larger than these hair-like things that they call needles. And they're more like hairs, filaments. And so, the slightest touch and they bend and bow. So these things are pretty much painless.
Okay. Well, you know what? That's a good place for us to go to a break. But when we come back, I want to talk about something called epigenetics. So everybody stay with us. We'll be right back with more of Another Look at Life right after these messages.
The best thing Tri-C did for me was give me opportunities. The workforce program prepared me for the career I have now. I got a job in the aerospace industry where I work on CNC machines. I have 3 younger brothers. I want to teach my brothers, hard work actually pays off. Come to Tri-C. It's a great stepping stone to wherever you're trying to get to in life. My name is Chris Grooms, and I got my start at Tri-C.
Start now at tri-c.edu.
This message was brought to you by WOVU 95.9 FM at Burton Bear Car Community Radio Station.
Welcome back to Another Look at Life. I'm Stephanie Phelps, and I am here with Dr. James Brown. Now, if you've been listening, we've been having the greatest conversation about health, wellness, medicine, and some changes that have happened along the way. So again, Dr. Brown, thank you so much for being here. And we promised to talk about something called epigenetics. So I'm really fascinated by this and a little bit confused because I thought that epigenetics was meant that your genetics, your genes, determine or have some kind of impact from your ancestors, and that can affect you along the way. Then I was listening or heard about this Dr. Bruce Lipton, who said that your genes don't have anything to do with it, and everything is kind of based more on your mind and your thinking. So finally, I looked up just the definition of it, and then I want to get your take. So what I found it says that it's the study of changes in organisms caused by modification of gene expression rather than alteration of the genetic code itself. Does that make sense? Yeah.
Yes. So the old science was that our genes determined our physical makeup, our physiology, the kinds of things that we were going to experience physically or physiologically as time went on, and also some of our emotional and behavioral characteristics.
Okay.
And it was thought that that was all encoded by the genes, and the genes determined those expressions. As it turns out, the genes are a template. They actually represent potentiality. So yes, they do have genetic expression, which is, why we have, the skin color that we have, or the lips, or the hair, or the size and the shape, those things. But also that those genes are alterable. Their expression is alterable by our environment. And that is not just our external environment, but our internal environment. And that was the revolutionary work that Dr. Bruce Lipton brought into being.
Okay, so our internal environment, is that for the most part the mind, the way we think?
Our mind and our emotions. Absolutely.
Okay.
Absolutely.
Now, what about people who think this is like really crazy and it's kind of like a lot of woo-woo, because I think a lot of people probably feel and think that it's about more than just positive thinking. If you can just, think things away.
Well, they're right. It is a lot more than just positive thinking. So what it is, because if you listen to Dr. Bruce Lipton's lectures or read his book, he uses a term that I don't entirely agree with, but I'll use it because most people are familiar with consciousness and subconscious. And what he's saying is that so you can have this positive attitude about something, but in your subconscious mind, and remember, I was telling you about the experience that made me want to become a doctor. Mm-hmm. So for the first 8 years of our life, our brainwave pattern is such that children are actually in a trance state. So they're absorbing the world around them. And what we do as children is imitate what we see. So those are the automatic programs that adults operate under, even if their conscious thoughts may be in contradistinction to what's actually going on underneath. So they may have this positive outlook on a situation, but underneath, as a child, they were traumatized by it, and there's still a fear. So the fear is actually still there, even though they're actually saying, I'm really not afraid of dogs. I'm really not afraid of dogs. But inside, their body is responding in a fight or flight response, pushing cortisol out, adrenaline out, changing their blood pressure rate, changing their respiration rate, even though they're telling themselves, I'm not afraid, I'm not afraid. That internal environment over time alters the gene expression.
Okay. Well, that makes a lot of sense. And one of the first thoughts that came to my mind, though, would that be more of healing that's needed with when they say you want to heal your inner child? And is that more a psychology than medicine that will affect you physically?
Well, that's a beautiful question, and I'll answer it like this. So even though Dr. Bruce Lipton is credited with this idea of epigenetics, in the 1920s, 30s, and 40s, there's a Russian scientist by the name of K.I. Platonov, and he wrote a book titled The Therapeutic and Physiological Effects of the Word. No, I'm sorry. The Word as a Therapeutic and Physiological Agent. And what he was able to show is under hypnosis, he can convince people such that if I give you a glass of water, but you're in trance, and I tell you that the water is alcohol, not only will you stagger and slur your words, I can actually draw your blood and find the metabolic products of alcohol in your bloodstream. The idea, if you're so convinced that this is true, your body will respond as if it is so. You have changed your physiological chemistry based upon your thought process, based upon your conviction. And that's a very profound thing. And that's what Dr. Bruce Lipton is building off of. You can't just change your conscious thought. You talked about healing the inner child. You have to have enough courage and the right technique, because you've got to do it in a certain fashion to go inside of yourself and find these triggers that are making you behave in certain ways that you have found not to be constructive in your life. And then reprogram yourself with this whole concept of what we call neuroplasticity. That means you can remold your brain. You can reprogram your brain to new ideas, attitudes, and convictions, so that under a same circumstance that used to trigger you for an emotional outburst, you can program yourself to behave completely different. You have used the word or your own idea, your own thought that you've programmed to change your behavior.
Wow.
And that behavior will change because, again, if we're living our lives with fear, with anger, with resentment, with frustration, those are the kinds of things, especially in Ayurvedic medicine and Chinese medicine, are some of the roots for disease processes, because these ideas cause energetic dysfunctions in our body. And that's the first stage of disease. Before the atoms and the molecules and the cells start to change, the energy within them changes. And that energy is governed by our perception, our attitudes, our emotions, our outlooks, our beliefs.
Wow. So for someone like me, you get this somewhat, on an intellectual basis, but how do you actually believe it? Like you said, that, you understand, you read books, right, read stuff. Yeah. Mm-hmm.
Yeah. That's beautiful, because Dr. Lipton was, as he actually left a teaching position at Harvard, because in his laboratory, he's showing how the external environment was actually changing how genes and cells behave. And so he's challenging the other professors. We can't keep teaching that genes are the source of our expressions and our behaviors and our physiology. We have to update the science. Even though they saw his data, they were reluctant to change what they were teaching the students. So he left. So he starts teaching elsewhere, and he starts giving these lectures. At the same time, he's going through a very messy divorce, and his life is in chaos. And it dawned on him, I really can't teach something that I don't know. So he had to actually start living and walking the talk and keeping this attitude of love, peace, and harmony. No matter what the external environment was, his internal environment was always going to be peace, harmony, joy, and love. And in doing so, he saw that his outcomes in life changed, and that's what was demonstrable to the people around him, subsequently to his students. That's how. So we don't prove it to anybody else. We have to prove it to ourselves. And the way that our life and the way that our life is lived shows the light to other people.
Wow.
So you have to prove it to yourself first. And the first thing is, if you've heard me before, I'm a big, big, big proponent of meditation. Because in doing so, your breathing actually alters your brainwave state. We talked about the children up until the age of 8 living in that theta state. Your breathing changes your brainwave state such that your brain becomes more receptive to ideas. And rather than having the external world teach you what life is, you now write your own script. You craft your own narrative while you're breathing in this way and your brain is receptive. And you do that often enough and long enough, and you can demonstrate to yourself your peacefulness, your calm, your grace under pressure, and how you actually can alter the things that trigger you such that they don't have that kind of effect on you anymore. And that's what you demonstrate to yourself. And gradually, the people around you will see the change too.
Okay, that makes sense to me. And I've been I've been meditating for a while, but other stuff comes in. But in the meantime, we got to take a break. So we are going to do that, and we're going to come back and talk more.
Hi, this is April Urban from Signal Cleveland, and you're listening to WOVU 95.9 FM, Burton Belcar Community Radio.
Hi, this is author Lady Patterson. You're listening to WOVU 95.9 FM, Our Voices United, Burton Belcar Community Radio.
Welcome back to another Look at Life. I'm Stephanie Phelps, and here with Dr. James Brown, MD. If you've been listening, you know what we're talking about. And if you haven't, too bad for you. You've missed some good stuff. So we're going to try to catch you up. So, Dr. Brown, when we were on break, I talked to you about how I first even heard of the term epigenetics and its effect on Black people, African Americans, who have ancestors who were enslaved. So you use the term post-traumatic slave disorder. Let's just start there, however you will.
Yes, ma'am. I would love to take credit for that, but there's a brilliant sister by the name of Dr. Joyce DeGruy, D-U-G-R-U-Y, who coined the term. And what she means is that as people of African descent in America, and most of us, not all, but most of us have had ancestors who were enslaved. The barbarity, the brutality, and the cruelty of that institution caused genetic changes that were passed down in our DNA. And some of the pathologies that we exhibit in our community today are a result of that treatment. And she has termed that post-traumatic slave disorder. So this idea for a long time until James Brown in 1968 decided for us to say it loud, I'm Black and I'm proud. Many of us had problems with our skin color, with our noses, with our lips, with our hair. And we went through all sorts of conniptions trying to alter that appearance. Some of us still don't like how we look. Some of us still think that we carry the curse of Ham or being inferior in certain ways to other races, especially those of the European descent. And so those behaviors that are non-constructive for us can actually be reprogrammed and can be changed, again, through what I was talking about with the concept of using the word as a therapeutic and physiological agent and the concept of neuroplasticity, that we can reprogram our own behavior through trance, through meditation.
Okay, so through meditation, would you also say through hypnosis? And I think a lot of Black folks are especially spiritual. Talk about that mind, body, and spirit connection and how all of those work together.
Yes. So, and that's the beauty of the Asian and the African concept of our being, that there are several bodies, not just one. Western medicine looks at just one body, and that's the gross physical body. Our cells, our tissues, our organs, our organ systems. And that's what they designed the healing about. However, we know right next to that is the electromagnetic body. That is our energy body. You know, it's like when you're in a space somewhere and somebody that you don't know comes real close to you and it gives you a certain feeling. Even though you're not touching, what you're experiencing is a disruption in the electromagnetic force around you from their electromagnetic force. You can feel them even though you're not touching. So that's our next body. And then that body is superseded by the emotional body, our emotions, the mental body, and then there's a couple more above that. But the disease can be in the mental body or in the emotional body that then affects the electromagnetic body that then affects the physical body. And so that's what we talk about: mind, body, and spirit. So you can't just fix one and expect the disease to go away, because maybe the disease is in the concept of, you know what, my mother never loved me. My mother never cared for me. And now because I don't feel that I was properly nurtured, I may have some aspect of in my character that is not allowing me to nurture myself or to nurture others around me. Eventually, that energetic imbalance will show up as some kind of disease in an organ system. And so you have to also fix the spirit, fix the mind, to make sure that once you fix the body, it stays fixed. Because if you just fix the body but don't fix the layers that contributed to the body's dysfunction, then the disorder will come back again.
Okay. So I'm thinking about not only physical dis-ease, but also mental, emotional dis-ease. Say if somebody has been diagnosed with some kind of, I don't know, a personality disorder or something. Is there, if they're aware of it, or I guess my question is, can using some of the modalities or all of the modalities, can anything be healed?
Yeah, because sometimes, you know, we treat bipolar illness, general anxiety disorder with Prozac, with trazodone, with Wellbutrin, with these serotonin uptake inhibitors. They increase certain neurotransmitters in the brain. But no study has shown that those disorders are due to low serotonin levels. So a lot of the emotional, mental issues that people have are actually coming from organ energies that are disruptive. So in Chinese medicine, if you have a liver spleen dysfunction, you will be a chronic worrier. If you have grief problems or, you know, loss, something has happened that where you've had a reversal in fortune, you've had loss of your health, loss of your job, loss of a loved one, and you can't get over that, you're going to have respiratory problems. If you've got anger issues that you can't resolve, you're going to have liver problems. And so many times fixing that organ will change the emotional imbalance that somebody has. Now, they're not always related to that, but a lot of it is due to the organ energy dysfunction. And you and you balance that energy there, and you will also alter the mental illness.
Okay.
And
No, go ahead.
Oh, I was going to say, that there's a study that was done, and I can't quote it exactly, but it was some city on the American seaboard, and there were some troublesome African-American boys. And they had tried all sorts of modalities to get them incorporated into the community as a positive asset. Nothing was working. They took these young men to an African village, took away their cell phones, took away their electronic games, and pretty much forced them to lead a tribal existence. Within 8 months, their whole behavior pattern had changed because they had changed their external environment. They had changed everything around them. They had changed their culture, and their acting out, their over aggressiveness, their lack of empathy for their community, all of that changed simply because they were eating differently, they were behaving differently, they were in a completely total environment where all their interactions were different. So you can fix people on many levels, with various modalities that don't require a patented pharmaceutical agent.
Okay. Well, you know what? In the remaining time we have left, this has gone really quickly. Speak to our audience about I guess, books, topics, even words, that if they're interested in this, that they can learn more.
Yes. So there's a book that I would recommend. I think you can still find it on Amazon. I'm not sure. It's called Stress Free for Life. The author is Ra Un Nefer Amen. And this is a book where he first starts off talking about the work of K.I. Platinoff, who I mentioned, but it also teaches 2 different ways of meditating and increasing your personal peace, increasing your ability to be in life, but not be so adversely impacted, to really alter that fight or flight response that we get because modern life can be so chaotic, because it can be so hectic, to really slow down and become aware of what's going on within yourself, to reprogram some of your behaviors, but actually to find that sea of peace by breathing a certain kind of way, by looking at life differently, such that you can see the beauty in it. And when things become a little bit more harried, how you can actually respond in such a way that will alter the outcome and even change some of the behavior around you, because you're not responding in a way that people expect you to usually respond.
Okay. Well, again, Dr. Brown, it has just been a joy and just fascinating conversation. I know you're getting invitations from all over the place, but I guess I just have to say, Lynn Hampton, thank you so much for introducing Dr. Brown to the community. And thank you so much.
I thank you for allowing me the platform too. I appreciate you.
Okay. And I want to thank everybody for joining us and invite you to come on back next week when we take another look at life.
Thanks for listening. Your voice matters. Inspire us with suggestions for upcoming topics and guests. Share your personal story, what's working in your life and what's not. Send email to anotherlookwithstephaniephelps@gmail.com. You can also find us online at anotherlookwithstephaniephelps.wordpress.com. We're very social. Like us on Facebook at Simply Another Look with Stephanie. Follow us on Instagram at Stephanie Phelps and on Twitter at Stephanie Phelps Living in Destiny.